Okay, so we're going to talk about how to properly perform the Scoot assessment, which is how we determine our patient's ability to move themselves in bed. Based on the scores of this assessment, we're going to choose which equipment we're going to use for patients at each of the levels. The Scoot assessment functions a little differently than the MAT assessment. Once you get to a step of the Scoot assessment that your patient is able to perform, the test stops. The first step of the Scoot assessment would be to ask my patient to scoot themselves up in bed. If they are unable, I would move on to the next step, which would be to give them some verbal cues. Ask your patient to bend their knees, plant their feet, and scoot themselves up in bed. If given these cues, they are unable to, I would move on to the next step, which would be to use the bed aids. In this case, it would be the bed rails, or to put the bed in Trendelenburg position as appropriate. With my bed rails up, I would now ask my patient, using those bed rails, to scoot themselves up in bed. If unable, I would continue on to the next step. The next step in this case would be to bend your patient's knees, plant their feet, and I would manually assist them by holding onto your patient's feet and asking them to move themselves up in bed. If even with manual assistance they are still unable to now move themselves up in bed, I would move on to the last step of the assessment, which would be to instruct them to bend their knee, or I can assist them with this, have them reach across and grab the rail on the opposite side and attempt to roll themselves in bed. If your patient is able to do this, the test stops. If they are unable to do this, the test also stops. This is the last step of the assessment. We total up our score, which gives us the appropriate score to determine which piece of equipment we would use for the patient at that level.